Good day to all. I am Dr. Sree Balaji, tutor at Department of Microbiology, Sree Balaji Medical College and Hospital, Krompet. Today I am here to discuss about a topic, disinfection, its applications and the methods of use in clinical and laboratory practices. So here today we will be covering the topics related to the types of disinfectants, where all you can use these disinfectants in both clinical and laboratory practices, and in which situation what kind of disinfectant is preferred to be used. So at the end of this session you would be gaining the knowledge about all these points. Talking a little about the history of disinfection. So initially in the 1800s there was no practice of disinfection that was followed as a guideline in any of the healthcare setups. So a doctor called Ignace Philip Semmelweis, he was a general physician from Hungary. He was the one who introduced this concept of disinfection. So he had observed that the maternal mortality rate in the wards where doctors were practicing was much higher when compared to the midwives. So he tried to find out what was the reason behind this kind of a change in the maternal mortality. So he observed that there was a limited hand washing between the patients when the doctors were handling the patients. So it ultimately led to a spread of infection from one mother to the other. He actually introduced the practice of using chlorinated lime solutions in between patients to disinfect their hands. So this drastically improved the maternal mortality rate and reduced so many maternal deaths. So he introduced this method of disinfection to reduce the mortality and discovered that this would help in reducing the infection transmission between patients. So this can be considered as the first infection control measure that was introduced in the history. So currently we have newer disinfectants and different methods of disinfection that we have learnt over the years. So today we will discuss about those practices. Going deeper into the topic, sterilization, it is a process by which a cell of living microorganisms, including the viable spores, are either destroyed or removed from an article, body surface or medium. It results in the reduction of more than 10⁶ colony forming units. So basically in sterilization, the microorganisms as well as viable spores are removed. That is a major distinction from disinfection, where it destroys or removes most if not all pathogenic organisms, but it does not act on the bacterial spores. Here it results in reduction of more than 10⁶ log colony forming units, but this does not include the spores. Now coming to the history part again, I want to emphasize on the role of Dr. Ignace Philip Semmelweis, who was an earlier pioneer of the antiseptic procedures. He was known as the savior of mothers. He devised practices to reduce the puerperal fever incidence by introducing hand disinfection in obstetric clinics. Now, we know that we need to disinfect all the medical devices that we are using, but we also need to know what kind of disinfectant has to be used in which device. So this depends on the exposure of the device in our body. So a classification known as Spaulding's classification was introduced to recognize what kind of device has to be disinfected in what manner. So all medical devices are classified into critical, semi-critical, non-critical devices and non-critical environmental surfaces. Critical devices are those that enter normally sterile sites. For example, a surgical blade is a critical device. It is entering into a sterile area. So here you need the maximum level of disinfection. So here you use either heat-based methods, chemical sterilants or high-level disinfectants. High-level disinfectants are preferred for such devices. The next is the semi-critical device. Here there is a contact with mucous membranes and there can be minor skin breaches. Here again a high-level disinfectant is used. An example of a semi-critical device is a bronchoscope or an endoscope. Here it does not enter into a sterile area, but it comes into contact with the mucous membranes. A non-critical device is in contact with intact skin. So here we can use an intermediate or low-level disinfectant. An example of a non-critical device is a BP cough or an ECG electrode that is attached to the skin of the patient. It is not penetrating into the mucous membrane or does not enter a sterile zone. A non-critical environmental surface. There is less direct contact with the patient. So here a low-level disinfectant can be used. This includes examples the furniture surrounding the patient. Here to disinfect we can use low-level disinfectants. Now we have understood what kind of devices require what kind of disinfection. But we also need to consider what kind of organism we are facing. So there are organisms which are highly resistant to disinfection. For example, prions which cause Creutzfeldt-Jakob disease, bacterial spores. Then the next resistant organisms would be coccidia. So in the order of reducing resistance, we can say that prions are more resistant than bacterial spores, which are again more resistant than coccidia, more resistant than mycobacteria, which are again more than non-lipid or small viruses, and again more than fungi. And the lesser resistant organisms are vegetative bacteria and enveloped viruses, which have lipid content in their envelopes. So based on this, the type of disinfection that is required in those scenarios will also differ. So for eliminating bacterial spores, we will require sterilization and we will require high-level disinfection for Cryptosporidium, which comes in coccidia, and Mycobacterium tuberculosis will require high-level disinfection. And whereas the non-lipid or small viruses will require intermediate level disinfection, the vegetative bacteria and the lipid containing viruses can have low level of disinfectants. Now, there is a classification of the chemical disinfectants which allow us to decide what level of disinfection can be achieved by using these chemicals. So, that is divided into low-level disinfectants, intermediate-level disinfectants, high-level disinfectants, and chemical sterilants. So, we see the susceptibility of certain organisms to these disinfectants to determine this. We see if bacterial spores, tubercle bacilli, non-enveloped viruses, fungi, enveloped viruses, and vegetative bacteria, and we see their response to these disinfectants. In low-level disinfectants, it works only on enveloped viruses and vegetative bacteria, and it may or may not work with fungi. In intermediate level disinfection, it works on tubercle bacilli, non-enveloped viruses, fungi, enveloped viruses, and vegetative bacteria. A high-level disinfectant again works on all the organisms that an intermediate level disinfectant works on, and it can have moderate amount of action on bacterial spores. So based on the concentration of the disinfectant, it can also cause damage to spores. A chemical sterilant is one which can also destroy the bacterial spores apart from the tubercle bacilli, non-enveloped viruses, fungi, enveloped viruses and the vegetative bacteria. So a chemical sterilant has to be used in case of a critical device. Now coming to the high-level disinfectants. Most commonly used high-level disinfectants are aldehydes. So here the examples are formaldehyde, glutaraldehyde, orthophthalaldehyde. So how do these aldehydes work? Aldehydes combine with the nucleic acids and proteins, and they cause inactivation of these compounds in the cell of the bacteria or viruses by cross-linking and alkylating these molecules. Basically, it damages the nucleic acid and proteins and inactivates the processes in the cell of the organism. Now, formaldehyde was previously used for fumigation of operation theatres, and now it is not that recommended because of its carcinogenic potential. Now it is currently used for the preservation of anatomical specimens and for the preservation of stool. Glutaraldehyde can be used for the disinfection of endoscopes and cystoscopes. A 2% solution is preferred. This is because glutaraldehyde is non-corrosive. So it can penetrate and can be used in the tubular instruments like endoscopes and cystoscopes. Glutaraldehyde along with a quaternary ammonium compound is currently used for fogging or disinfection of an operation theatre. Orthophthalaldehyde is also non-corrosive and can be used instead of glutaraldehyde for endoscopes and cystoscopes. The next is hydrogen peroxide. So hydrogen peroxide, as we all know, liberates toxic free hydroxyl radicals which can attack the membranes, lipids, DNA and cellular components of the bacteria. So these free radicals are involved in the damage to the cellular surface. The percentages that can be used are 3% is used for inanimate surfaces. For ventilators and soft contact lenses, 3 to 6% of hydrogen peroxide is used. Vaporized hydrogen peroxide is used for plasma sterilization. Now, plasma is a gaseous state which contains a lot of free radicals and ions. These ions will act on the organisms under a specific pressure condition to produce disinfection and sterilization. It acts as a sterilant. So hydrogen peroxide can be used in plasma sterilization. Ethylene oxide. Ethylene oxide is one of the gaseous sterilants that is used for disinfection. It is used for heat sensitive items like petri dishes, syringes, etc. Also for sutures, catheters, heart-lung machine components and dental equipment. Ethylene oxide is microbicidal as well as sporicidal. We have seen that in a lot of syringes, with the disposable syringes, it is sterilized by ethylene oxide. So they have a plastic covering over the syringe. So here we understand that ethylene oxide has a good penetration, and so it can penetrate inside the plastic wrapping and sterilize the syringe, the disposable syringes. So it is used for syringes, sutures, catheters, heart-lung machine equipments and dental equipments. Next is peracetic acid. Peracetic acid is similar to hydrogen peroxide in that it is also an oxidizing agent. It is a high-level disinfectant and a chemical sterilant. Peracetic acid is used to sterilize endoscopes, arthroscopes, surgical and dental equipments. It is specifically used to disinfect hemodialyzers. The disadvantage of peracetic acid is that it corrodes steel, iron, copper, brass and bronze. So it is not as commonly used as hydrogen peroxide. And coming to the intermediate level disinfectants. So the most common disinfectant that we use nowadays is alcohol. So alcohol is an intermediate level disinfectant. Alcohol is bactericidal and fungicidal. It can work on enveloped viruses, but it cannot act on spores. The mechanism of action of alcohol is that it denatures the proteins and dissolves the membrane lipids. The most commonly used alcohols are ethanol and isopropyl alcohol. It is used in a concentration of 60 to 80%. The most commonly used alcohol is currently in the hand rubs as an antiseptic. Ethanol can be used as a 70% solution as an antiseptic in hand rubs. Isopropyl alcohol is specifically used for the disinfection of clinical thermometers and small instruments. Small medical items and surfaces like vaccine bottles, hubs of central lines, etc. can be disinfected using alcohol. The external surface of equipments like stethoscopes, ventilators, etc. are also disinfected using alcohol, and disinfection of surfaces is also done using alcohol. The next is a phenolic compound. So phenol, cresol, lysol are the surface disinfection agents that are used for bedside tables, bed rails, laboratory surfaces, etc. 5% phenol is used for the disinfection of sputum samples when we receive it for tuberculosis testing. Chloroxylenol is another phenol that we commonly know as Dettol. It is an antiseptic agent that is commonly used. Coming to the next agent, they are halogens. Halogens includes iodine and chlorine as the most important compounds used for disinfection. So iodine, it is an oxidizing agent and it oxidizes the cell constituents and it iodinates the proteins. The commonly used iodine compounds are povidone iodine, that is betadine. It is used as a 5% ointment and topical solution for wound cleaning. 10% surgical skin preparation compound is used. 10% of povidone iodine is used for surgical skin preparation. Chlorine is the next type of halogen that is used. The main components of chlorine that are used are chlorine, free chlorine and hypochlorite. Free chlorine is used for the disinfection of municipal water supplies and swimming pools. Sodium hypochlorite is used for the management of spills in a hospital. In case of large blood spills, we can use 0.5% of sodium hypochlorite and in small blood spills 0.05%. Pre-treatment of liquid waste can be done using sodium hypochlorite. Before the disposal, it uses 1% sodium hypochlorite and surface disinfection is done using 0.5% sodium hypochlorite. Low-level disinfectants includes quaternary ammonium compounds. Examples are benzalkonium chloride. It is a surface active agent and is used alone or in combination with glutaraldehyde. Another low-level disinfection is a biguanide. Examples are chlorhexidine, that is commonly known as Savlon. It is used as an antiseptic. It is used as a 4% solution in hand wash, a 0.5% solution in hand rub. The skin disinfection before surgery is done using 2% of chlorhexidine solution. Now, we can have an exercise to choose the appropriate method of disinfection in clinical practice. So, the most commonly used in clinical practice, the thermometer. So, how do we disinfect a thermometer? So, an oral single-use item can be disinfected using 70% isopropyl alcohol wipe after use, and it can be stored in a dry place. In between patient use, it has to be wiped clean and it is washed in a cold neutral detergent and immersed in 70% isopropyl alcohol. Then it is stored in a dry place. Stethoscopes are disinfected using 70% alcohol. It is a dedicated stethoscope is preferred to be used in high risk areas. Next, the endoscopes, they are disinfected using a high level disinfectant, that is 2% glutaraldehyde or orthothalaldehyde, 7.5% hydrogen peroxide or 0.2% peracetic acid. Ethylene oxide also can be used for the disinfection of endoscopes. Pulse oximeter can be disinfected using alcohol-based products are not allowed to be used on pulse oximeter probes. It has to be cleaned using detergent wipes alone. In conclusion, today we have learnt about the disinfectants, the type of disinfectants and where all we use the disinfectants. We learned how to categorize the medical equipment based on the exposure level of the medical equipment into critical, semi-critical and non-critical devices according to Spalding's criteria. And after this, we have also learned how to use the disinfectants for each type of medical equipment based on this criteria. We have also categorized the disinfectants into high level disinfectants, intermediate level disinfectants and low level disinfectants, and we have understood the applications of these disinfectants. So I hope you have all understood very well about this topic, and I thank you for your patient listening.